Hello, welcome to Epidemiology Part 3. This is the final portion of the lecture on epidemiology. We're going to talk this time about descriptive epidemiology and analytical epidemiology. So descriptive epidemiology is where you gather and organize data about the person, place, and time of the health event. So we look at who, where, and when. So your who would be the person, the where would be the place, and time would be when they would become ill. And in order to operationalize this, we use the person, place, and time model. And so with this, we find all of these facts and put them together. So with the person, we look at individual characteristics. We might look at height and weight and other diseases and problems. We also look at things like race, ethnicity, culture. We look at occupation. We look at like economics. What are the breakdown of salaries in a community? We look at, are people of a particular socioeconomic group more heavily burdened with the disease? We look at, do they have access to care? Do they have insurance? All of these make up the information about the person. So they're all about their characteristics, their social habits, and other factors. Next, we look at where it happened. We look at the actual geography of where, and then we look at other things like with behavior patterns. Is there a high crime rate in the area? Are there other events or issues that go on that create a problem for that particular area? Is there some type of sewage issue? Is there some type of plant that may be issuing some kind of toxic substance into the neighborhood? These are all things that we look at when we talk about place. With time, we look at how does this event play out over time? Does it go away? Does it get worse? Does it come and go? Did it have a sudden start? Was it a slow start? We look at all of these things. And we also look at something called event clusters. And this is when we start having some kind of event that relates to a particular point in time. And like there was an event a couple of years ago where a lot of kids started becoming ill, and it turned out that they were getting measles. They were coming in with measles, and the event cluster all clustered around Disneyland. So they had been in the park and they had been exposed to people who were not immunized for measles and who had contracted measles. So this would be what we would look at for an event cluster. Also, we look at people who maybe came off of a cruise and have developed some kind of illness, or the people that ate at a particular restaurant on a particular day, and then later we find out one of the healthcare workers tested positive for hepatitis A. So that's what we use that for. So the three main ideas as far as descriptive epidemiology is, we talked about what it is. We're looking at the who, the where, and the when of a disease. We're looking at the determinants and the determinant factors of the disease or the health event. And we're also looking at, and we also discussed the person, place, and time model, and that this is what we use to carry out our descriptive epidemiology. So next we're going to take a look at analytic epidemiology, and we use analytic epidemiology to discuss the why and the how that health problems occur. And this looks at relationships. How do things relate to each other? And we do this by a variety of ways. We look at observational studies and experimental studies. Remember that observational studies do not, we as researchers do not insert ourselves into the process. We're not providing some type of experimental intervention. We're not providing any type of new medication or new education or anything. We are just simply looking at people and things the way that they are. And so with this, we observe the exposure and the disease status and monitor it over whatever period of time is appropriate. One of the ways that we do that is with the cohort study. And with a cohort study, we look at a group of people over a period of time, and we make recordings as to whether or not that person was exposed. And we continue to follow the cohort to see if disease develops. And one of the biggest cohort studies done, especially in this country, is the Framingham study. And if you've ever done any type of research on heart disease and cancer and some other issues, you will find a reference to the Framingham Heart Study. And what this is a town in Massachusetts, in Framingham, Massachusetts, residents there agreed to become part of a study. And they began looking at this study, I believe, in the 40s. We're going to click on the link and go there. And yeah, it began in 1948. And this was formerly the National Heart Institute. And what they were doing is looking at what were the common factors that identified risk for cardiovascular disease. Because back in 1948, we didn't understand that eating a lot of foods that were high in fat and in calories and greasy and all of those things would eventually lead to coronary artery disease. And so this study provided that information. And this study is continuing. There has been a third generation that started in 2002, and there are some new offspring spouse cohorts and another omni cohort that began in 2003 as well. So this is, we have children of the children of the children of the original participants who are in the study now. And you can come on here and log in. If you live in this town and you're part of this cohort, you can come in and log in and provide information. And this just gives you different information about the study. This has been a source of enormous research. And if you're wanting to do a different study about this, you can click here and come on and participate in their study. They have a great link here for risk of heart disease that you can look at. Like here's congestive heart failure. And this is probability. So this is looking at your risk for men 45 to 94. And it goes on down. So this is also a place of good information for you if you are providing educational information to patients, or you're wanting to write some type of paper about risk factors. This is a really good site for that. A retrospective study is where you take a look at something that's already happened. Usually we do this by reviewing medical records. We can also send surveys to patients and ask them questions. So this is looking at something that's happened in the past. That's why it's retrospective. You're looking back. I did a retrospective study when I was working on my master's degree. My research partner and I did a study for a cardiologist office. And he was interested in knowing which type of educational program that they had offered in the past for patients that were having pacemakers or internal defibrillators implanted was the most successful as far as patients having fewer complications and post-op infections. And so we went through all of the records and we divided all the patients into the patients who had this particular program of study and this group that had another program of study, and we calculated out which had the better outcomes, and we had a set of criteria that we were using to look at that. So that's an example of a retrospective study. A case control study, when you first look at it, seems a little tricky. So I want you to pay attention to this. A case control study it's still an observational study because we're still not doing anything to anybody. But what we're doing is we enroll a group of people with a disease, and then we enroll a control group that does not have a disease. Normally, when you have a group and a control group, the control group is not getting treatment and the other group is. We are not doing an experiment here. So we are simply observing a group of people that has a disease and a group of similar people who do not have a disease, and then making comparisons and observations about the differences over a variety of criteria. The criteria would depend on what you're looking at. Are you trying to compare and look at how patients with diabetes fare at a certain age versus patients that don't have diabetes, or patients with diabetes who have pneumonia versus patients who don't have diabetes and develop pneumonia? This would be an example of something that you would look at under a case control study. Now we're going to look at experimental studies. And with this, the investigator uses a controlled process to determine exposure of a community or individual. And this community is tracked over time to determine the impact of the exposure. And so remember, this is an experimental study, so this is a controlled process. This is different from a case control in that the case control is observational. We're only looking at people. With experiments, we're doing something. So the three main ideas here were what are analytic epidemiology and observation and experimental studies, and then know an example of each one. With epidemiology and surveillance, nurses use epidemiology and surveillance to identify certain trends. For example, we look at minorities and their health risks and health threats, and we look at what interventions do we need to provide in order to improve the health of minorities. We also look at geography. What kind of effect does geography have on the population health? And we look at age and ethnic distribution. Generally with age, the very young and the very old are the most at risk. We saw a difference to that with H1N1 in that we had a lot of young and somewhat healthy people who became very, very ill, and some of them died with H1N1. And that happened because their immune response was very active and responded in an extreme way because it was so active. So it's only by looking at and surveilling things like this that we discover these particular facts. We do have requirements for reporting certain diseases. These requirements are mandated by state law. The state determines, the state health department for each state determines what diseases are to be reportable. Then those diseases must be reportable by providers, and they have a method of how to do that. We'll look on the websites in a minute to kind of explain it, which will help. Understand that the CDC compiles all of this data. They have this list of diseases that they will track. The CDC does not determine what diseases are reported to them. The state health departments make those decisions. So we have a national notifiable disease surveillance system, and we have those, that's how all of this information is tracked, and it's published every week in the MMWR. And we're going to take a look at some of this. So if you look here, this gives the list of all the diseases that are notifiable. These are the diseases that all of the states got together and they told the CDC the things that they want to track. And these are the things that the CDC will track. Now, not every state is going to track all of these diseases. So each state will notifies the CDC and says, we're going to track these diseases. And so then they compile this list out of all the things that all the states want to track. So for example, you can look at cancer. and it gives the case definition. You may remember we talked about case definition in Epidemiology Part 1. This is what tells us whether or not the condition that someone has meets this criteria, is this disease. And so this gives you the description. It tells you the laboratory criteria for diagnosis and what a confirmed case is. If you look at some of the other conditions and diseases, let's look at anthrax. You'll see that the case definitions have changed. Remember, we talked in Part 1 about how case definitions change over time, and that's because as we begin to work with a disease or an illness and observe it over time, some of the things that we thought determined that this person had the disease or found out to not be true, or else not as effective. And so the case definition evolves over time as we learn more about the disease. And here again with anthrax, there's cutaneous, inhalation, gastrointestinal, oropharyngeal, and meningeal anthrax. So all the different types of the diseases are listed there. Under case classification, you have a suspected case, a probable case, and a confirmed case. And providers are supposed to report suspected cases. We don't wait until we have all of this probable or confirmed. We want the authorities to be aware that something like this is going on, because we need to go ahead and begin investigating before we go to this. And some diseases can take a long period of time to get from suspected to confirmed. And so we need to act so that we can protect the population. And then we have the list that Texas reports. And we want to look at color because color is more exciting. And here you'll see, you'll see that it lists a number for the things that are immediately reportable. And they've placed immediately reportable in red, so that just kind of jumps out at you. And you know, if you see one of these cases, you need to call this number. And then the blue cases are things that need to be reported within a day. And then all the other cases can be reported within a week. So you can take a look at this, and you might want to print this out and have this available with your coworkers, and then everyone kind of has an idea of what they need to be reporting. And then we have the National Notifiable Disease Surveillance System. And this site gives you information about it. This lets all the levels of public health, it's local and state, territorial, federal, national, international. So other countries can share information here. And there's a fact sheet here that gives you information about it as well. And you can read this, you know, you find this on the link. It was over on this part of the page. And this explains what it is and lists different programs that are responsible for the surveillance. And this explains how to connect and get all that information in. And there's a whole list here of contact information that you can provide your colleagues if that's something that would be helpful for them at work. So this gives you a set of resources that you can use and look at. And so understand that diseases are notifiable based on state mandate. The CDC is the clearinghouse. They compile the data that is sent to them, but they do not require that people give information specifically to them. So the three main ideas are: how is surveillance used in population health? What agency determines what diseases are reported? And is reporting mandated by state or federal law? I hope you're all saying state. Okay, great. And that concludes epidemiology. Please let me know if you have any questions. I'll be happy to hear from you.